Sorry, how did I not delete them? Claire. Fabulous. So next up we have Phil Roberts, also from Leicester Trust. He's a Pint ambassador and going to talk to us today about setting up a home artificial nutrition support group and keeping along our theme of keeping our patients at the centre today. Thank you, Phil.
Firstly, as a same one Pint ambassador to another, I just want to say what a great job Ezekiel did today. I feel like I can't do anywhere near as good as him, but I will try and do the best that I can. I have an ulterior motive coming here today because I'm very passionate about support groups for tube feeding patients, and I'm really hopeful that either somebody in this room or somebody listening online may can sit here that what I've done and hopefully inspire somebody else to do it. Let's move on. The key thing as well, Carolyn was very kind, has given me a Pint email address, so if anybody does want to ever contact me to discuss setting up a Pint group or any information, the email address is there, so please get in touch with me and let me know. Just a little bit of a background in terms of how I got involved with support groups and within Pint. In 2013 in Leicester, we decided we were going to do a focus group for our patient group, just to find what they thought of our service, what we were doing well, what they'd like us to do better. One of the key themes that came from that focus group was patients and parents, carers, talking about that need for kind of peer support, and that really kind of fitted in with what I was seeing when I was seeing patients. A lot of people would tell me they'd never ever seen anybody with a feeding tube before, so it was all very new. And they were very much saying, you know, they appreciate the support we could give as NHS professionals, but they also knew that most of us had not ever had a feeding tube, and really wanted to meet somebody who's living with that feeding tube on a day-by-day basis, find out how they live their life, what they do, and how they get through things. So that was one of the key themes that came through. And then as a massive coincidence, I think pretty much within weeks of doing that, a magazine article I read, unfortunately I keep talking about this magazine article, I wish I kept it, but it was basically encouraging dietitians to set up Pint groups, and the two kind of things seem to go together. As somebody who'd spent the whole of my 20s never organising anything and just turning up when I was told where and when, the idea of setting up a support group was completely out of my comfort zone, and I can't actually remember what actually just made me decide to volunteer and give it a go, but I did, and here we are going today. So I always say if I can do it, anybody can. So in 2014, I became a Pint ambassador. We met in Birmingham as well, and we started the Leicester group. A little bit about that Pint ambassador meeting was held in Birmingham. I kind of thought it was a really good idea because as somebody who'd not set up a support group before, what a fantastic opportunity I thought to meet other people who were doing similar things, kind of share what was working, what worked well, what didn't work, and just kind of get ideas. Well, when I turned up, I think I was expecting there to be a lot of dietitians. It turned out there were some dietitians, but not many. So we all introduced ourselves, and we saw there's quite a few patients, carers, quite a lot of nutrition nurses. But the only dietitians there were myself and Julie, who's also here today. So two dietitians, which kind of really surprised me. And the key thing I would say here is I'm not saying that dietitians are better at place in nutrition nurses or patients to do Pint groups, but it's more about how we can maybe get more dietitians involved so we are covering more of the country and more people have access to that kind of support group. Why I think dietitians make good Pint ambassadors, the first thing I've put there is that we have access to people who are new on tube feeding. So we would always, within our team, within a week of them going home with a feeding tube, meet that person, and that's like the perfect time in some ways to discuss Pint with them and discuss what services Pint offers. A key thing I would say when it talks to Pint is we're talking, obviously the focus of my talk is support groups, but support groups are not for everybody, and Pint have their online newsletter, kind of forums, literature, so everybody can kind of use Pint in a different way. But one thing I also pretty much identified quite quickly is sometimes the first time you see a patient is not actually the best time to discuss pint with them, because a lot of the time I see people and actually their main focus is, how do I look after this tube, how do I get my feeding equipment, and the last thing that they're necessarily thinking about is swimming, going on holiday, or all those kind of things. And often it might be the second visit, third visit, fourth visit that maybe I speak to somebody and say, you know, actually, this is a point that maybe we discussed it in the first visit when you had 100 other information sheets, but maybe this is a kind of time to bring through pint again and see maybe whether pint's right for you at the moment. So it is kind of an ongoing thing. Some people visit one, but sometimes it can be 3 months, 6 months, a year, 2 years, 3 years, 5 years before we find that people want to engage in that way. We also have links to the feeding companies as dietitians who support with invitations. Now, when it comes to invitation, there is a baddie involved in this story here. When I first started with Pint, we got our feeding companies to send invitations to everybody. This really meant that we could kind of cover pretty much our whole caseload in terms of sending the invitations over. Somebody, it was not a Leicestershire patient, but somewhere in Britain decided to complain that they had an invitation with no real patient identifiable information or anything. It was just purely an invitation. Because that one person complained, that basically stopped invitations going out from feeding companies. So that kind of avenue, which was the easiest and best avenue for us, was taken away. So it does make it more difficult in terms of invitations. We also sometimes might have room availability or the ability to hire rooms and refreshments. And also within our admin team, we have access to admin support who play an amazing role in us, I'd say, if we can't target everybody sending those letters out to people. A bit of background in the Leicestershire meeting. We've been running twice a year since 2015. One of my proud moments was we were the first group to restart after COVID. I wish I could then tell you a story about the first meeting and the experience I had. Unfortunately, 2 or 3 days before the first meeting, I got the dreaded double line, so I didn't actually attend the first meeting back after COVID. One lesson that taught me was really that you should have a plan B, and I did not have a plan B, so this was a bit of a kind of manic speaking to colleagues, please can somebody do this meeting, because the last thing we wanted to do was arrange this meeting and it would be cancelled. And luckily my colleague Elizabeth stepped in and did an absolutely amazing job. So yeah, I've attended everyone, but as I say, always look to have that backup if you can't do it. What we do in the Leicestershire meeting, tend to at the start, it's a great opportunity to update patient on pints, and always before the meeting I send an email to Carolyn and ask her what's going on in pint world, and we just talk to the patients about what's involved in pint. Sometimes just give them an update in terms of the resources they have, kind of the luggage tags, etc., the restaurant cards, and we also appreciate that as it's an ongoing thing, we're getting new people all the time who haven't necessarily heard the previous information, so it's a great time to update people. One of the things that to me is the best part of the meeting is, again, I'd like to say this was my idea, but we were very lucky that somebody called Sylvia, who was involved in Pint in the past, basically did the first couple for us and really showed me what worked and what didn't. One thing she talked about was getting somebody to get in front of the group and talk about their life with a feeding tube. We tend to do 1 to 2 people. And sometimes I find it's the people that you least expect who would want to do this, but actually a lot of people are really keen to share that experiences, just I think to have that kind of avenue to talk about their life, talk about what they've experienced, but a lot of people, they want to help other people. For example, last time we had somebody who'd run marathons, competed in sporting events abroad, and I think as a group people can find that quite inspirational, hearing what other people do and that they aren't held back. We also try to have guest speakers. I feel since we've been running since 2015, I'm starting to get to a bit of a dead end in finding new guest speakers, so we're potentially going to have to start rotating through again. But we've had people from the feeding company talk about their holiday services. And one thing I do say in terms of the feeding companies, I find that the group really do actually like to meet somebody from the feeding company, because often it's somebody at the end of a telephone, but to get that face-to-face contact and speak to somebody from the feeding company is great. We've had nutrition nurses do talks, dental hygienists and pharmacists. I try to basically tailor the groups in terms of speakers, in terms of what people want. It's really hard because you ask people what they want, and I get a lot of shrugs of the shoulder. But one thing people did say is they wanted a bit more advice in terms of mental health support. It was a real struggle for me to get a speaker to talk about mental health. I tried once, emailed everybody, struggled to get anybody to even reply, never mind agree to come. But last meeting we had somebody from Mind who came, and the group really appreciated that. And one of our kind of things that we do as part of the meeting, that raffle, because we want to raise money from Pint to help in that way as well. A couple of things I've not put on this slide, but I think are quite relevant, is in the Leicester group, we are enteral nutrition and PN. We don't kind of separate things into two different groups. I only really know how Nottingham work, and they work in the same way. I don't know throughout the country if people do different things, but our kind of ethos has really always been to put people together. And another thing I would say is, just because it's Leicester group doesn't mean that you need a Leicester postcode to visit. We will welcome people from anywhere in the country that they choose to come, and we regularly get people coming from Nottingham. We've had people coming from surrounding areas, and I think at the start I was kind of worrying about, and I certainly asked neighbouring dietitians whether they were happy for me to have invitations. I worried if it may cause a few problems in terms of different areas of the country asking about different things, but when you start the meetings you quickly realise that people are not interested in other departments' advice about sterile water and jejunostomy sort of thing. They're very much kind of practical and about kind of how to live life, etc. A little bit in terms of considerations in terms of setting up a group. First thing that we really thought a lot about was what the best day was to have the meeting. In Leicester, we've gone for a Saturday morning. We've kind of recently evaluated that, and Saturday morning still comes up as our best day to do the meetings in terms of people not be working, not necessarily going to schools, etc. But we're also aware that whatever day you set it, some people will be included and some people will miss out. The good thing that we have good links with Nottingham as well, being the county next door, is they do run theirs on a weekday afternoon, and that means potentially if you can't make the Leicester group, you could come to Nottingham or vice versa. Venues is my biggest hassle in terms of setting up a support group, and the things that drive me up the wall more than anything. It's easy enough in terms of finding the type of venue you want. We look for kind of say accessible location, pretty central in Leicester, good access from the roads or public transport if that's what you're looking for, a suitable size, you don't want it too big or too small, but also good parking, disabled access and disabled toilets. It's easy to find a venue, but getting that venue confirmed is a lot more challenging. We in the past have gone through, we started off basically with our home care company sourcing and paying for the venue for us, and then our trust decided that they wanted to take it over. Unfortunately, what I found when the trust took it over is the amount of loopholes we would then have to go through. I would suggest a date, they would say fine. By the time they'd gone through every meeting they needed to confirm this, the venue had gone, it had been booked, and then we were back to square one. So we're back with a home care company doing it for us, and that really works quite well. And that home care company, they supply basically refreshments and things as well. In terms of advertising, as I say, we had the perfect way of advertising in the past until, as I say, the villain of the story decided that was no longer going to happen. We aim to do a save the date letter about 3 months before and an invitation about a month before. The reality is that's what would happen in an ideal world, and often it's that save the date letter seems to be about 6 weeks before and the invitation maybe 3 weeks before, but it always kind of works out in the end. We do try to target people who we think would be interested in a support company, in the support group. I am a bit wary of that. I was discussing with Carolyn before, because I think sometimes people you think may be interested excludes people who would be interested but are maybe not the most outspoken. And we've had people in the past who come to the group, are very, very quiet, don't really contribute much in terms of speaking, but then they tell us at the end how much they benefited from it and are not necessarily the natural people that we would have targeted. So while we do, I think, look at the people we think would come, I think we need to be very careful in terms of spreading the net as far as possible. Clearly, we do target people who have been before, who are an obvious group to target, but there's always better we can do. I try to get our admin, when they post things out, just to send letters to everybody, and we try and advertise on social media and ask Pint to do it as well for us. Key thing in terms of the Pint group is how we involve the patients, because I'm very keen to say, while I'm organising this, facilitating it, it is a patients group, and I want the patients to be involved as much as they can be. And when I say patients, not just the patients, the carers, because I think sometimes the carers are the forgotten ones, and actually living with somebody with a feeding tube is in many ways just as challenging as having the feeding tube yourself. It's just different challenges, and it's really keen that we get the carers involved as well. So, as I discussed before, we've got individual patient stories, we have people who bake for us, and we even have people who are nil by mouth and can't eat, but still bring refreshments in for us. Invitation design as well. Key thing in terms of this kind of group, we've got a whole host of people with loads of different skills, and I will hold my hand up. There are people in our group who are much better at designing invitations than I am, so another great way to get them involved. We ask them the kind of guest speakers we want to involve. We kind of evaluate our meetings and try and change the meetings to fit in with what they want. But one of the members also does the raffle for us, so brings a book and sells all the tickets. So we try to get people involved as much as we can, but we've generally kept that we're still getting the oversight in terms of organising it, because we've always felt that we were in the better position because we have the patient information to do that. The fact that there are well, I think, as I say, when the ambassador meeting there was 2 of us. There's a few more now, but still potential that there could be a lot more, I think. So I wanted to talk about some of the barriers that I could sort of, and kind of think about how we can overcome the barriers. Probably the biggest barrier is knowing where to start, and when I started I didn't have a clue where to start, and as I said, I got involved, contacted Pint, and Pint put me in touch with one of their ambassadors who got that experience of doing it before, and kind of she went through it with me in terms of what she was doing, and that kind of made it easier for me to follow on. And then I kind of paid it forward with Nottingham, I suppose. So when they decided they want to start, because I've got that experience, I was able to kind of talk them through it. So, you know, you're not starting afresh, you kind of tap into other people's experience. I guess another thing is time constraints, and we're all so busy, and it's another thing to do. My experience is there's a bit of work at the start, getting it all set up, but I don't find it takes up a whole lot of my time. I say there's frustrations in terms of booking rooms and things, but I don't think it takes a lot of time. And in terms of the actual presentation, the kind of meeting itself, we're talking about every 6 months, half a day. It doesn't seem like it's that much to me. The third point is a bit that I always panic about, and that's, will people attend? And the trouble with my Pint group is they are terrible at telling me if they are going to attend the meeting. We clearly put the invitations, please RSVP, and then nobody ever does RSVP. So you turn up in the morning of these meetings not having a clue if anybody is going to turn up. But luckily luckily so far people do turn up. We've had really good turnout so far. In terms of how many people we get, I think in terms of our combined enteral and PNK, so we're probably around the 900 mark. We probably get anywhere, I would say, between 10 and 20 patients, which when you think of it as a percentage of your caseload, is very, very small percentage of caseload. In my head, when I started, I think, oh, we can get 10%, we can have this room full. And now, when I've got like 10 to 20 patients, pretty much everybody brings one as a person, you actually find that is a nice enough number to have it in the room. We're always looking to expand it, but I certainly have never felt that that number is too small to justify doing it. Another question that I put is, do we have the experience to do it? Whether that's in terms of running a group. And not the dietitians I also speak to, they get a bit scared about this PN side of thing, because a lot of us are enteral focused, but we've got no PN experience. As I say, we've had, it's kind of changed. We got to probably at one point a third PN, 2/3 enteral. It's gone down a little bit more recently, but I find that the PN people turn up to the meetings. That I've never once been asked a question about PN. If I did, I would direct it to the healthcare professional, but that's not really what the meeting is about. That kind of specific advice to that specific patient is really about that peer support. Another concern with the boundary with me being a kind of enteral dietitian and a Pint ambassador. I think I've kind of really made it quite clear when I've done these meetings is when I'm there as a Pint ambassador. I'm not there as a dietitian. If people have specific questions related to their own care, then that's not really the right time to ask it, although, you know, I refer them to speak to the dietitian at another date. But to be honest, I find it's never really an issue. People don't tend to ask those kind of very specific medical kind of questions. It just isn't the kind of priority in a meeting like that. So in terms of how I can support you, so as I say, if you are thinking about setting up a support group, and as I say, please do, I would encourage everybody to give it a go. You know, tap into my experience. I'm more than happy to help anybody who wants to get involved. Let you know what I've done, how I did it, how we meet. In terms of resources, so we've got kind of invitations set up, we've got save the date letters set up, so I'm more than happy to let people steal them. Like I said to Nottingham when I first met, don't reinvent the wheel. If you want to do your own invitations, absolutely fine, but if you feel that ours kind of fit your need, you can just adapt them with your details. So more than happy to share what we do. Also just happy, as I say, via email or grab me today to answer any questions you've got, or kind of signpost you to Pint resources that are available. We do evaluate our groups, and by the nature of the kind of size of the groups, it's not a massive sample size, but we evaluated fairly recently to the meeting we did. So in terms of our group, everybody said they enjoyed the meeting a great deal or a deal. A great deal. How interesting, again, everybody, a great deal or a lot. And are you likely to attend a future meeting? Everybody said yes, which is kind of what we're looking for. As well as evaluating our meetings for our patients, I always look at evaluating our support groups myself and seeing what we can do to make the support group a bit more kind of inclusive, more diverse, etc. And when I talk about that, I'm not necessarily just talking about ethnicity, but also different ages, different medical conditions. We found that a lot of people in the past have come to a group and then never come back because they said there's nobody like them in a group. And for example, recently we had somebody, I think about 21, 22, who emailed me after saying that she wanted to come but didn't want to come because she didn't think there would be any young people there. So it's really hard because you can't, unless people are willing to stay to be that other person, then sometimes it feels like you're fighting a losing battle. But we try to do what we can to attract younger people. So last time we had a younger speaker, but also Carolyn asked me to find a patient to write a review. So I found the youngest group member and I begged her, please write a review, but please write your age in that review, because we are desperate to get some younger people in the group. So we're looking at that. In terms of medical conditions, we don't have many people with learning disabilities. We don't have many children going into the group, and it's kind of like looking at why that's happening and if there are ways that we can attract different people. I think in some ways we find some medical conditions have kind of support groups set up already related to the condition, and maybe that impacts on the amount of people who come to that group. A lot of people who come to our group, I kind of find that we get a lot of kind of people with gastro conditions where there aren't particularly established set up groups already, and maybe that's why they feel that Pint's a good offer for them. But we certainly don't turn down anybody with, say, head and neck cancer who may have more established groups. We're kind of welcome to everyone. So in terms of benefits to patients and carers from Pint groups, Key thing, as we say, is an opportunity to socialise with others living with artificial feeding. We see a lot of people saying that before they had the tube, their life revolved around kind of eating, drinking, and they're often put off doing a load of those social activities that they used to do before, and actually going to a pint group, you know, people will bolus feed and they'll pump feed. It's kind of like a safe space almost for them, because nobody's going to judge them or look at them strangely for doing it. It's just kind of, people have that experience and it's a shared experience. Key thing as well, I'd say, to contribute to the running of the group. Also people to share their ideas and experience, and I find people get very different things out of the group. One example I would give is we have somebody who comes to the group, basically grandmother whose grandchild's got a learning disability, and once I chatted to her after one of the group and I asked her what she saw, and she said the thing that she got most from the group was she was able to speak to a group member about what it feels like when they flush a tube, because her grandchild couldn't communicate that to her, and that was something that really surprised me. It's something that I never would have thought about, but that was the main thing she got from the group. So people get lots of different things. And also a key thing there is about forming friendships. In the last group we had, people were exchanging phone numbers, and it's great that we can possibly create friendships, get people to have that kind of outside the meeting support. We also had a very interesting episode in our last pint meeting where somebody's feeding tube was blocked. And what we found out was if you do have your feeding tube blocked on a Saturday, a pint group is a perfect place to be, because there was somebody with their tube feeding badge, came out with a syringe, found some water, and the tube was unblocked, and no hospital admission on a Saturday, and potential weekend admission needed. But it's not just benefits to the patients. I think there's huge benefits to the dietitian. As I say, one of the key things, an additional way of supporting our patients and carers, which I think we're all keen to offer. As I say, it's not for everybody, but it is something that we can offer. Also, I've kind of put, from my perspective, it's really nice to meet patients outside that clinical environment, because the way they talk to you, I find it difficult to explain, the way they talk to you is very different to that kind of patient home visit, but also understanding the needs of our patients and carers and understanding what we may think are the needs. They are actually prioritising other things, and in terms of how they can live their life as independent as possible, what they can do, and I think that really improves me as a professional. But also in terms of benefits, experience of running a group session, involvement with a fantastic national organisation like PINE, but also it's like a fun social event, and that's the key thing we say. I think support group has got a bit of a stigma when people hear that word, but it is really a social event. A lot of it is just people chatting about whatever they want to chat about. And just to finish off, just my summary is that dietitians can play a crucial role in setting up these support groups, and please consider it, get involved. It's a huge benefit to, as I say, both dietitians and the patients, but don't let the barriers hold you back, and the key thing to know is that there is support available, so please you seek that support out, and please everybody start up your own groups. It would be nice to see more pint groups throughout the country, and thank you everyone.
Thanks very much, Phil. It's certainly a hard act to follow, but you did it great. Thanks. So important for us all to be getting involved with these groups. So our next speaker is Celia Kitzinger. She's joining us remotely, so I think I need to change a few things on the...
Can you hear me or see me?
Oh, I